Patients come to you with a head injury and expect you to know how severe it is and how quickly to treat them. The American College of Emergency Physicians says that the triage process causes long wait times and crowding in the emergency department. A triage nurse assesses the severity of the patient's condition to determine who is seen right away and who can wait. But just because someone in the waiting room doesn't look sick doesn't mean that everything's fine. Diagnosing a head injury can take a long time, especially when the emergency physician is ruling out life-threatening conditions. Tests such as a CT scan take time that an emergency department physician must manage effectively to optimize resources and patient care. Your emergency department is now equipped with an FDA-cleared medical device that aids in assessing the likelihood of brain injury caused by mild head trauma. BrainScope One is a revolutionary brain injury assessment technology that provides you the ability to non-invasively, rapidly, and objectively assess the full spectrum of your patient's brain injury, including the likelihood of a structural injury visible on CT and concussion. It is up to you, the physician, to choose whether to use it. But when you do, it will increase your confidence that your patients have been objectively and comprehensively assessed. By watching this video, you'll learn why you should order BrainScope One for your assessment of patients who come to you with a potential traumatic brain injury. The underlying technology of BrainScope One employs sophisticated algorithms, advanced signal processing, and machine learning to assess brain injury. BrainScope One is sensitive to structural brain injury visible on a CT scan. The BrainScope One assessment can be performed by a technician or nurse in only minutes. The output provides actionable information to help you, the physician, triage for CT imaging, reducing wait times either in the waiting room or in the patient room and helping you make a clinical diagnosis. Given the peer-reviewed literature shows that 91% of CTs are negative, BrainScope One can give you greater confidence in your clinical decision, potentially reducing exposure to unnecessary radiation. BrainScope One has been specifically designed to address the two most important initial clinical questions about mildly presenting patients after head injury. First, is there likely an intracranial brain injury which would be visible on a CT scan? This is addressed using BrainScope One's proprietary EEG-based structural injury classifier. Second, is there likely a functional brain abnormality? This is addressed using BrainScope One's proprietary EEG-based brain function index, known as the BFI, which scales with the severity of functional impairment. In addition, two neurocognitive tests can be performed rapidly right on the BrainScope One device if your department chooses to add the tests. These tests will help you further assess the patient for the likelihood of a concussion. Both the BrainScope Structural Injury Classifier and BFI biomarkers are derived from the same EEG recording and provide information along the full spectrum of traumatic brain injury. At the core of BrainScope's proprietary Structural Injury Classifier is a selected set of EEG features which best characterize the pattern of changes in brain electrical activity that occur with TBI. These features include measurements of the EEG's signal complexity and shifts in the frequency spectrum. The Structural Injury Classifier also includes selected clinical features which likely coexist with such changes. For example, a loss of consciousness. The BrainScope BFI is an EEG-only marker that captures changes in brain electrical activity, thought to reflect the physiology of concussion. Such features include measures of the disruption in neuronal transmission, which are seen as a disturbance in EEG connectivity between brain regions. The efficacy of BrainScope One was demonstrated in an FDA-independent prospective validation trial of 720 patients and 11 academic emergency medical centers across the U.S., including Johns Hopkins, Emory University and Grady Memorial, University of Virginia, and Washington University in St. Louis. The trial was conducted on adult patients within 3 days after head injury, with a mildly presenting patient population with an average Glasgow Coma Scale or GCS score of 14.9 out of 15. This FDA validation trial demonstrated that the proprietary BrainScope structural injury classifier was extremely sensitive to even the smallest amount of detectable blood present in the CT scan, with a sensitivity of 99%. Further, the FDA trial results showed 98% negative predictive value, or NPV, which supports a very high level of confidence that the patient does not have a TBI when the device finding reads negative. And the structural injury classifier demonstrated specificity significantly beyond that of standard clinical decision rules for scanning head-injured patients, such as the New Orleans Criteria, NOC, or the Canadian CT Head Rule, CCHR. In comparison to other screening imaging tools and biomarkers used as standard of care today, the BrainScope structural injury classifier is at the top, with 99% sensitivity to hematoma following head injury. For example, troponin, the blood biomarker for diagnosing an MI, only has a sensitivity of between 25 and 65% within the first 2 hours of injury, and mammography only has a sensitivity of 69 to 90%. Results of the BrainScope structural injury classifier are presented to the user in one of 3 categories to quickly help you determine if your patient requires a CT scan. The categories are likely CT positive, likely CT negative, or equivocal. Equivocal, or the gray zone, identifies a patient that is close to the threshold of positive, much like other commonly used medical descriptions such as pre-hypertensive or pre-diabetic. Details of the validation trial and the derivation of the structural injury classifier can be found in the peer-reviewed Journal of Academic Emergency Medicine, published by Hanley and colleagues in 2017. BrainScope's proprietary Brain Function Index is the device's second biomarker, which also uses EEG to help the clinician assess for functional brain injury, and was shown to significantly scale with degree of clinical functional impairment after head injury. A large, healthy, normal population was used as a de facto gold standard, since there is no gold standard for concussion assessment. The BFI, therefore, is expressed as a percentile from 0 to 100 of the distribution of the normal population, akin to the percentile that a student might get on an SAT score, with the lower score being worse than the higher score. Thus, the lower the percentile score, the more likely the patient has abnormal brain function. The BFI is presented on the screen not only as a percentile, but also in 3 color-coded categories, black, yellow, and red, calculated as statistical distance from the mean of the normal distribution. Details of the device's BFI validation and derivation can be found in the peer-reviewed Journal of Neurotrauma, published by Hanley and colleagues in 2017. BrainScope One uses objective, validated technologies. It was originally developed in partnership with the United States Department of Defense to assess head trauma, a significant military health concern. And over an 8-year development period, 4 separate FDA clearances were obtained, culminating in the BrainScope One medical device. Further, BrainScope One was developed through 21 clinical studies at 55 clinical sites. The technology and clinical utility are described in 23 peer-reviewed publications. BrainScope has also received a number of awards for this groundbreaking technology by peer-reviewed judges. BrainScope One is FDA cleared for mildly presenting head-injured patients with a GCS of 13 to 15, between the ages of 18 to 85 years, and within 3 days of patients experiencing head injury. Training to operate the BrainScope One medical device is straightforward, fast, and easy. It takes approximately 5 minutes to apply the headset to record the EEG, and about another 5 minutes to acquire the data. When completed, you get results of both the BrainScope Structural Injury Classifier and the EEG-based Brain Function Index. These tools can help you objectively assess if a CT scan would be the proper course of action for a patient and if there is functional impairment requiring proper concussion follow-up care. Note how a summary of all tests is combined on one screen as a panel. These patient results can be printed, stored, and shared. In short, BrainScope One works by showing you patient assessment information that is objective, rapidly delivered, and comprehensive across the full spectrum of brain injury, and it's configurable to address your specific needs. Your decision to use BrainScope One will benefit your patient, especially when compared with only getting a CT scan, which exposes the patient to radiation. CT scans are only sensitive to specific types of structural brain injury, most commonly those that involve a bleed. While CT scans are the ubiquitous gold standard for assessment of head injury in hospital emergency rooms around the country, many other traumatic brain injuries are not visible on CT scans, although they can be seen on advanced neuroimaging scans such as fMRI. EEGs are also sensitive to many of these injuries not visible on CT scans. With EEG at its core, BrainScope One is sensitive to both structural and functional brain injuries. Therefore, when the BrainScope structural injury classifier reads positive, but the CT scan taken thereafter is negative, there may still be pathology in the brain that a CT scan cannot show. In addition, taking into account the increased risk in older patients to suffer brain injury when they sustain a head injury, the BrainScope One structural injury algorithm has been purposefully designed to be conservative in its assessment of structural injury in this older population. This will sometimes result in scanning an older patient who may turn out to be CT negative. There are also significant time benefits for the patient and your organization. Assessment time for BrainScope One can be as short as 10 to 12 minutes or longer, depending on the type and number of assessments selected. And it's all done right in the ED. That means your patients can be rapidly assessed, and if your determination is that no CT scan is needed, discharged quickly, with thorough understanding of their condition. Using BrainScope One for all appropriate patients can facilitate quicker patient triage and assessment, potentially shorten the patient time spent in the ED, which can substantially improve patient satisfaction, reduce the back-and-forth patient transfer process, and aid in more optimal use of resources. A CT scan can also be uncomfortable and time-consuming, while the BrainScope One assessment is rapid, non-invasive, and patient-friendly, and can be administered immediately without the need to move patients to a different room. Then there's the fact that the BrainScope One technology produces no ionizing radiation. A single CT scan, on the other hand, exposes your patient to 400 times more ionizing radiation than a dental X-ray. Cost is another major benefit. Hospital emergency room visits are expensive, especially when you add the cost of CT scans. A BrainScope One assessment is significantly less expensive. Also, patients found to be CT negative are often discharged without evaluation for concussive injury because CT scans are not helpful for physicians to assess concussion due to the limitations of CT technology. BrainScope One provides important additional objective information related to concussion. The BFI indicates potential impairment in brain function, which helps inform discharge referrals for further evaluation for concussion or referrals for post-concussion follow-up care. Note that BrainScope One is not intended as a standalone diagnostic or to be used as a replacement for a CT scan. But when you do use this medical device as part of your assessment, it can provide important additional objective information to aid in your diagnosis and care path decisions. BrainScope One brings unparalleled benefits to brain injury assessment through the power of modern technology. This unique, breakthrough capability provides comprehensive and objective data to help make clinical diagnoses more effective. Ordering a BrainScope One assessment is the right course of action for your head injury patients to help ensure they get the care they deserve.